Should you use heat or ice for low back pain? I'm Dr. Anthony Davis. Let's review the evidence and my opinions as far as using heat or ice or both or neither for low back pain management, both acute and chronic. Let's start off with icing. It's perfectly natural for people with low back pain, especially if it just started. You had an acute onset, you pick something up, now you have low back pain, to want to ice it. The argument in favor of ice says that we would reduce swelling, that we would decrease inflammation, and it would help with pain relief. Does the old dogma of reduce swelling, reduce inflammation actually even matter? Well, the argument against using ice would say that, well, if there is a bit of swelling, that's sort of a natural brace. It keeps things stable while you're healing. It would say that, well, what is swelling? Why is the area hot and painful and swelling? Well, it's because it's inflammation. What is inflammation? Oh, that's your body's way of naturally healing. It's the way of clearing out the debris from damaged tissue, of bringing more blood flow into the injured area. And along with that blood flow brings oxygenation and nutrients, building blocks, so that we can, again, repair the damaged tissue, clear away the debris, and get you back to full health and strength as quickly as possible. So we need inflammation to some degree. So the question arises, do we want to be limiting that type of inflammation with ice? If ice reduces inflammation, reduces swelling, and reduces blood flow, do we want to do that if we're trying to heal? Along with this, part of the argument against using ice is there are sometimes some risks. If ice is used carelessly, we do risk sometimes permanent nerve damage, for example. Again, this would be if you're using ice irresponsibly, too long, or using ice directly on the skin without layers of towels between you and the ice. Should we or should we not use a certain treatment for a certain condition? And all of the newer guidelines are suggesting don't use ice. And for that matter, they're saying don't use anti-inflammatory medication as well. Things like Advil and Tylenol are also going to slow down blood flow and slow down the natural healing response. So here's what I tell my patients in the clinic. I tell them don't use ice if the swelling that you do see is very minor. And by the way, this advice is not just for low back pain. Honestly, this could apply to any injury under the sun. So don't use ice if the swelling is very minor. Don't use ice if the pain that you're experiencing is fairly tolerable. If you can deal with the pain, then don't use the ice. And don't use the ice if the injury is more than 3 days old, because you're out of that inflammatory cycle anyway, at least the really, really acute part of it. On the other hand, I tell patients, sure, go ahead and use the ice if the swelling is out of control, which is not going to be the case in low back pain. It's more like if you sprain your ankle or if you tear an ACL or something like that, and your joints are swelling up like a balloon. Please get that swelling under control because you are at risk of compartment syndrome. In that case, obviously, get the inflammation under control. Another reason that I would tell my patients, go ahead and use the ice, is if the pain is just unbearable. Obviously, ice is a good painkiller. So if it just really, really hurts, please go ahead and use the ice if you feel like you need it. Just realize that it is only there to help with the pain control. It is not helping with the healing. In fact, it is slightly delaying your healing. So if you need it for pain control, I get it. Go ahead and use it. Another criteria that you could use to use ice would be if the injury that you had was less than 3 days ago. If it was very, very recent, there is a better rationale behind using ice. But honestly, even if you injured yourself 10 seconds ago, if it's not really severe, if it's not bruising, if it's not severely swelling, and if the pain isn't excruciatingly bad, then the ice is not necessary. You could skip it. And another weird reason that I like to use ice is actually for more chronic pain, because we get these neuromodulatory effects. What I mean by that is that ice is a really intense stimulus for your body. And so if we can sort of recalibrate the nerves to get used to a really intense stimulus, then by contrast, the pain that you were dealing with will feel less intense. If we can tell your tissues that are hypersensitive to to chill the fuck out, then you're going to feel a lot better long term. And lastly, another reason that I personally really like to use ice is, I take cold showers every single day. I love to take ice baths as well, but I'm not doing that for the health benefits, although there are other health benefits to exposing yourself to cold temperatures on a regular basis. The reason I do it is because I find it extremely meditative. I find that it trains my nervous system to be able to handle very intense stimulus without freaking out. So I can actually control the fight or flight response, which is a really, really cool thing if you think about it. And the natural response is to take a deep breath or shiver, right? To have this autonomic reaction to it. But if you can control your nervous system to not panic and instead be able to take deep, slow breaths, I think that that's an incredibly powerful practice. So I think ice can be a very powerful teacher. Obviously, I'm assuming you're using it safely and not for too long. Do not give yourself frostbite. Don't be stupid. If you're struggling with chronic low back pain, I have a free 30-page workbook that you can download right now. The link is in the description. It will teach you how to fix your low back pain and get your life back. Okay, now let's talk about heat. So the argument for using heat is that heat improves blood flow. If it improves the blood flow, it's going to bring more oxygen, more nutrients to the area, and it's going to aid in the healing process, hopefully speeding up the healing process. Also, just as with ice, heat also provides pain relief. So as for the pain relief aspect of things, sometimes it really is personal preference. Some people just feel that they get more pain relief from ice, and some people just feel like they get more pain relief from heat. So if you have a preference, just do whichever one you enjoy more. Now, most of the time, conventionally, when we're talking about using heat as a treatment for any kind of pain or injury, we're worried, oh no, it's going to cause inflammation. Now, here's a weird thing, though, is there are several studies that I've cited here that show that actually using saunas or heat treatments, actually, if you do use them for long enough, can reduce chronic systemic inflammation. It takes a lot of research to film these videos. Please show your appreciation by liking and subscribing. Okay, the argument against using heat. So we would say, oh, we don't want to use heat. Traditionally, we would say this because it might make the swelling worse. And if it does, that might impair your healing. Like I said, there's compartment syndrome, where if it's really, truly swollen like a balloon, you are cutting off the blood supply out of the affected area. Now, in low back pain, this isn't such a big deal because the blood is just not going to get trapped in your low back. But if you sprain your ankle and it's swollen like a balloon and you heat it like crazy and it swells up even more, then you are trapping all the blood to your foot and it cannot go back up to your heart. And then it essentially leads to compartment syndrome, which is trapped blood, no oxygen, dead tissue. And you have to get surgery for that. They do a fasciotomy, cut you open, drain it. So obviously part of the argument against using heat is that if it's incredibly swollen, you are at risk of some severe consequences. So please, obviously in that case, ice it. But that's only in really severe cases. That is very rare. And then another argument against using heat is actually one of the most common reasons that chiropractors and physical therapists get sued by their patients, which is burns. It's hot. And if you leave it on too long, or if you put on a heating pack with no towel in between the heat and your skin, or you do that and you fall asleep because the heat is very relaxing, and you fall asleep with the heat on and you don't realize that it's burning you and you wake up with a burn, all these things are common. So be smart about using heat, put towels in there, don't fall asleep, limit the amount of time that you're doing that. And that goes for heat or ice. And then of course, the other part of why you would not want to use heat in our traditional or old or outdated thinking is, oh, it increases inflammation. Inflammation is bad. Inflammation is not always bad. We need inflammation. That's the process of healing. And like I mentioned earlier, when I was talking about the arguments in favor of using heat, well, it turns out that although heat increases blood flow and inflammation short term, actually long term, it might reduce chronic systemic inflammation. So what do I tell my patients about heat? I tell them not to use heat if the swelling is incredibly severe. I tell them not to use heat if they put the heat on and it makes their pain worse. That means it's too much inflammation. stop it, cool it down. And I tell them not to use heat if the injury is extremely severe or extremely acute, meaning extremely recent, less than 3 days old. But even with that 3-day thing, if it's a very minor injury, I'm okay with you using heat right away as long as it doesn't make the pain worse. It's probably just fine. On the other hand, I tell my patients, go ahead and use some heat if the swelling is really minor, if the heat relieves your pain, if it feels good, do it. That's perfectly fine. I tell them to go ahead and do it. If the injury is very minor, if they don't even notice it, if you can't see it in a mirror, or if you're still able to walk around, you hurt your back, but you're still able to walk around reasonably well, probably just fine to use heat. And honestly, even if you had an acute disc herniation, it would still be fine because back injuries usually don't swell up like that anyway. So it's usually not a big deal. As with ice, I also like to use heat for the chronic pain, the neuromodulatory effects that we see there where we recalibrate the nerves to be less sensitive. So I think that's pretty cool. Like with ice, I like heat for meditation. It feels good to be in a hot bath or a sauna. So if you find that relaxing, guess what? Your mental health is super important for healing from pain, especially chronic pain. So if you can go take a hot bath or a sauna and relax and meditate, I'm all for it. It's going to help with your pain. And I like heat because it helps to improve your range of motion. It will help you feel more relaxed and heat up the muscles and improve that range of motion. So when you get low back pain, especially if it's whether it's acute or chronic, honestly, we can be very tight and guarded. And if we can just teach ourselves, hey, it's okay to relax. You don't need to be so guarded all the time. Movement is medicine. Motion is lotion for your joints. Heat can help you achieve that. I mentioned this heat and ice can recalibrate hypersensitive nerves by showing them the extremes of sensation. I think this is pretty cool. I've used this with patients who have chronic pain and very complex types of chronic pain, and where your nerves are physically just too sensitive, where if you just touch the person, it feels like pain to them. And that is absolutely a real thing. Your nerves are chemically more sensitive. They do not know what is too much and what is not enough, and what is pain and what is not, what is damage and what is not. It is like you have nerves that are like a glass break sensor in an alarm system, and the glass break sensor is supposed to trigger the alarm only when somebody shatters the glass violently and we've got 120 decibel sound, very, very loud sound. That's supposed to trigger the pain alarm system in this case. But your nerves or your alarm system, your glass break sensors are poorly calibrated, and they go off anytime somebody sneezes in the house or anytime somebody slams a door a little bit too loud. It's just going off when it shouldn't go off because there's no intruder, there's no damage. And that is a physical thing that we need to teach your nerves what is worthy of an alarm. And so by teaching at the extremes of hot and cold, your nerves become less chemically sensitive to normal sensation. Now, beyond heat and ice is a way bigger picture. The big picture here is if you're worried about heat or ice for your low back pain, you're worried about the wrong things. New injuries just need a little peace and love. These are the new and my favorite guidelines for injuries and pain. And the fact is that we don't need to be worried about heat and ice. What we really need to be worried about is exercise, movement, optimism, get some blood flow, get out there, start moving it as much as you can tolerate. That's the thing that's going to get you better, not heat or ice or what if I self-massage? What if I hit that, specific muscle in that specific trigger point? None of that stuff really, really matters. The stuff that really matters is moving your body on a regular basis and, managing stress, getting good sleep, etc. I'll go into that in just a second. But these are the current guidelines for acute injury. So even if you injured yourself in your back yesterday, you pulled out your back yesterday, peace and love. Basically, for a couple of days, if we want to protect, with back pain, you can't elevate, but if it was an ankle injury, you could elevate it. For a couple of days, if we want to protect it and avoid super painful activities, that's fine. After that, don't worry about it. It's probably not dangerous. Avoid anti-inflammatories like ice and anti-inflammatory medication. You could compress it if you want. Obviously, that's tough with the low back. Education that hurt doesn't equal harm, that it's okay to move even if it's a little bit painful. And then the love part is my favorite because load, optimism, vascularization, and exercise are key here. They even doubled up the vascularization and the exercise and the load. They tripled up. telling you to move, right? Load, pick up heavy things, exercise, do any kind of full range of motion things, restore your mobility, and vascularize. That's cardio, get the blood pumping. They told you to exercise in 3 different ways. That's how important they think that movement is in the new guidelines. So ice and heat are indeed useful for pain control, but the focus for healing really needs to be on education, exercise, stress management, sleep, and nutrition. If you're worried about heat versus ice, trigger point massage versus deep tissue versus whatever kind of massage, or if you're worried about should I do this corrective exercise or this stretch or this, that stuff, get out of your head. It does not matter. Big picture. Move your body, manage your stress, get good sleep, eat good food, and you will be miles ahead of where you were today. If you want to know step-by-steps how to fix low back pain, I made a playlist just for you. Be sure to watch this video next.